Hello, fellow students. I am Yang Han, a teacher of Chengdu University of Traditional Chinese Medicine. Welcome to the online classroom of TCM Gerontology. Dizziness is a particularly common symptom of the elderly. The word dizziness is often heard in daily life and outpatient clinics. Epidemiological surveys show that 30% of the elderly over the age of 65 have experienced different forms of dizziness, among which women are more common. For every 5 years of age, the possibility of dizziness increases by 10%. Studies in China found that the overall prevalence of vertigo in people over 60 is 4.1%. So, what is dizziness in medicine? Today we will study the etiology and clinical manifestations of dizziness together. First, let's take a look at the definition of dizziness. Dizziness is a deformation and distortion of the body's spatial sensation and positioning. Its symptoms may include top-heavy feet, unstable standing, dizziness, and perisyncopy state. According to the duration of dizziness, it can be divided into acute dizziness, onset time less than 2 months, and chronic disease, onset time more than 2 months. The dizziness of the elderly often lasts longer. In addition to dizziness, patients with chronic disease are often accompanied by a series of symptoms, including depression, anxiety, dysfunction, falls, syncope, and so on. Next, let's take a look at how Chinese medicine recognizes the etiology and pathogenesis of dizziness. There are 5 common causes. The first one is emotional trauma. Liver anger hurts the liver. Depression hurts the liver, leading to hyperactivity of the liver and disturbing empathy. The second is the unhealthy diet, damage to the spleen and stomach. Damage gather dampness and produce film. The third is overwork, spleen and stomach damage, accumulation of dampness and film. The fourth is the old kidney deficiency. The marrow C is insufficient, can't fill the brain. The fifth is the servant injury, chi stagnation and blood stasis, arthralgia clearing. All of the above 5 types can cause dizziness. From the perspective of the disease location, the dizziness diseases is located in the brain, and the diseased organs are mainly liver, involving the spleen and kidney. The pathological factors are mainly wind, fire, flame, and blood stasis. Wind and fire originate from the liver and kidney, and the spleen is the source of flame. The 3 are related to each other, so it can be seen that the wind and fire are instigating. The wind and flame are blinded, or the flame and heat are masked, and even the wind and fire flame are obstructed by clearing. The pathological nature has both real and false ends. Those with liver young hyperactivity, flame turbidity and obstruction, and blood stasis obstruction are sick. Those with deficiency of qi and blood, empty marrow C, and deficiency of liver and kidney are ineffective. The false and the real can be combined with each other or transformed, but most of them are false. In elderly patients, liver yang is hyperactive and the wind is disturbed. What are the clinical manifestations of dizziness? Let's take a look at the type of dizziness first. Currently, dizziness is regarded as a major concept in clinical practice, including the following subtypes. The first is dizziness, which means paroxysmal or persistent brain unclearance. Dizziness, head swelling, and tightness in the head. Elderly people with a history of hypertension or mental factors can often cause dizziness. However, dizziness can sometimes be a physiological process, such as lack of sleep, fatigue, long-term insomnia, etc. This dizziness and more rest, adjustment of work and rest can be corrected. The second is vertigo, which refers to the symptoms that the patient's subject has an illusion of movement about the static surrounding objects of their own possession, mostly pathological phenomenon. It is often manifested as a rotation of the site or his or her own rotation, but it can also be unstable, undulating, and falling. Generally, the patients do not dare to open their eyes when vertigo develops, and they are often accompanied by nausea. In several cases, autonomic symptoms such as vomiting, sweating, and blood pressure fluctuations may occur. The second is imbalance, which means that there is a dizziness sign of unstable standing, of movement disorder in action, without a sense of rotation. The fourth is the state before syncope, which refers to the symptoms of chest tightness, palpitations, dizziness, darkening of the eyes, and fatigues before syncope. The core is instability. For example, when orthostatic hypotension occurs, the pre-syncope state is prone to occur. This shows that dizziness is a broad concept, and dizziness is only part of it. Many elderly people often see the symptoms of mixed dizziness, and the pre-syncope state is the most common subtype of dizziness in the elderly. In addition, the dizziness of the elderly is often the result of a combination of factors. Chronic dizziness is associated with multiple risk factors, such as angina, myocardial infarction, arrhythmia, arthritis, diabetes, stroke, anxiety, depression, hearing impairment, and multiple medications. Next, let's take a look at the classification of dizziness. There are two main categories: disease-induced dizziness in the vestibular system and disease-induced dizziness in the non-vestibular system. Vestibular system disease dizziness is divided into central and peripheral categories. The former includes transient ischemic attack of posterior vertebral basal artery system, cerebral infarction, cerebral hemorrhage, brain tumor, encephalitis, or demyelinating disease, vestibular migraine, dizziness, epilepsy, and so on. The latter includes Benioparoximal positional vertigo, Meniere's disease, vestibular neuritis, labyrinthitis, and lymphatic leakage. Non-vestibular systemic dizziness mainly refers to diseases of internal medical system, such as blood pressure, arrhythmia, and other cardiovascular diseases, blood diseases, endocrine diseases. Excessive activity, long-standing overwork, changes in environmental conditions, severe cold, extreme heat, plateau, hypoxia, mild heat trauma syndrome, visual fatigue, and eye diseases, such as myasthenia gravis, glaucoma, inflammation of facial features, upper respiratory tract infections, and adverse drug reactions or poisoning. Additionally, it also includes psychogenic dizziness, such as depression, anxiety, hypomania, and obsessive-compulsive disorder. What are the common diseases and clinical features of dizziness? The first is Benioparoximal The first is Benioparoximal positional vertigo. Patients often have a sudden onset. When the head is in a certain position, the vertigo appears, which can last for tens of seconds. When turning or reversing the head position, the vertigo can reduce or disappear, but nystagmus is obvious. Patients often look at the bed and sigh, unbearably looking back. The duration of vertigo varies greatly, and most of them relieve or disappear simultaneously within a few hours or days after onset. The second is Meniere's disease. Patients are often accompanied by tinnitus, deafness, dizziness, and ear swelling. The vertigo is intermittent and recurrent. The vertigo is the most serious at the beginning. When the head moves and eyes open, it can aggravate, accompanied by nausea, vomiting, paleness, slow pulse, decreased blood pressure, and nystagmus. Each duration lasts from a few minutes to hours and several days. After multiple attacks, the vertigo decreases with the aggravation of the affected site, and the vertigo also disappears when it is completely deaf. The third is posterior circulation ischemia. Patients often have nystagmus, accompanied by other symptoms and signs of the nervous system, and often have a history of hypertension, diabetes, and heart disease, divided into two types according to clinical manifestations. Transient ischemic attack type. The attack can be several times a day or once a few days, usually a few minutes to half an hour to relieve. Those who are mild only have dizziness and instability, and those who are frequently attacked, developing seizures. To complete labyrinthine stroke. Number 2. Progressive stroke type. Dizziness and tinnitus continued to increase after the onset and reached a peak after a few days, obvious nystagmus, with focal signs of the nervous system. The fourth is vestibular migraine. Patients with recurrent attacks of vertigo, with or without headaches. The attacks last for as short as tens of seconds and as long as several days, often with nausea and vomiting, reduced symptoms after vomiting, which can occur dread sounds, photophobia, joy, quietness, and a few patients may have very short-term blurred consciousness. Dizziness can be exacerbated when the head position changes during the onset of symptoms, usually after quiet rest or sleep getting better. The fifth is psychogenic dizziness, also known as mental dizziness. Dizziness in these patients is related to mental disorders or psychosocial factors, such as depression, anxiety, panic, compulsive, or somatization disorders. Despite dizziness or vertigo, patients often have somatized symptoms, such as palpitation, chest tightness, indigestion, and poor sleep. Symptoms often last for months or even years, and some are accompanied by subjective sensory disturbance and pseudoataxia symptoms. Well, today we will stop here. Thank you all.